Pulmonary capillary weight pressure is a good approximation of left atrial pressure. In mitral stenosis, pulmonary capillary weight pressure is over left ventricle and diastolic pressure. Pulmonary capillary weight pressure is measured with pulmonary artery catheter, Swan-Ganz catheter. Cardiac catheterization is performed to evaluate for cardiac etiologies and obtain direct measure of intracardiac pressure in patients with unexplained symptoms. In general, right side pressure are much lower than those of the left side, as the right ventricle is pumping blood into a much lower resistant pulmonary vasculature. A balloon-tipped pulmonary artery catheter attached distally to a pressure transducer is inserted into the subclavian or internal jugular veins. When the pulmonary artery catheter balloon tip enters to the superior vena cava, a venous waveform appears, and the balloon is inflated with air, and the catheter is advanced. The location of the catheter tips is determined by the pressure reading as follows. The venous pressure waveform of the SVC appears as small amplitude oscillation. The pressure remains unchanged as the catheter is advanced into the right atrium. Normal pressure in the SVC and right artery atrium is 1 or 2 millimeters. Number 2, as the catheter is advanced across the tricuspid valve into the right ventricle, a pulsatil waveform depicts systolic pressure is the strain of the right ventricle contraction, and the lowest diastolic pressure is just below the right atrial pressure. Right ventricle systolic pressure is normally 50-30 millimeters. As the catheter advances across the pulmonary valve into a main pulmonary artery, the pressure waveform shows a sudden increase in diastolic pressure with no change in systolic pressure. This rise in diastolic pressure is due to pulmonary capillary resistance and backward transmission of the left atrial pressure. The pulmonary artery catheter diastolic pressure is normally 6 to 12 millimeters. When the catheter is advanced into the distal pulmonary artery branch catheter, a venous tip wave appears. It is called the pulmonary artery catheter occlusion pressure or pulmonary capillary weight pressure. This pressure is reflective of venous pressure in the left atrium. Left atrium pressure and left ventricle diastolic pressure. Pulmonary capillary weight pressure is normally equal to pulmonary capillary diastolic pressure, 6 to 12. Right-sided pressure in the heart are lower than left-sided pressure due to lower resistance in the pulmonary vasculature. Right ventricle diastolic pressure is similar to right atrial and central venous pressure, 1 or 6, whereas pulmonary artery diastolic pressure is slightly higher, 6 to 12, due to resistance of flow into the pulmonary circulation.